We specifically need research that's directed toward prevention. Some of the things that I think are huge opportunities, one is to keep antibiotics working. We have a real problem with the evolution of our microbes that are pathogens toward being resistant to antibiotics, and lots of antibiotic-resistant infections in the hospitals, some of which are coming from the use of antibiotics clinically, some of which are coming from agricultural uses. This is a huge problem. I hate to see us go back to the 1930s when we can't treat infectious illness. The other thing that I would say is, with the issue of smoking, it's an area where there's a tremendous disparity. It was mentioned that there are these social networks where people continue to smoke, but those tend to be people who are less educated, who are poorer, and they are not necessarily a part of our social networks. What we're finding with our research, I think we need more of that research, is that we need to reach into those networks and use those networks to help people to quit. That we can't expect that the same messages that have resulted in the reductions of smoking that we've seen to date are going to work for the people who continue to smoke. Childhood obesity, how do we prevent that? How do we protect our children from a lifetime of chronic disease because they're starting out obese in the first place? We need to review the evidence in a very systematic fashion and understand what's working and what isn't working, and move as quickly as possible to move these better practices into communities. CDC is doing some of that, the schools of public health are doing some of that, but we need to bring that together. This is an emerging public health crisis with a generation of children, the first generation in a century who will be less healthy than we are if we don't do something about this.